at Optimal Physical Therapy. I'm joining you once again in relation to those videos that we had talked about in my introduction. Today's video is going to be about the ACL prevention and rehabilitation process we use here at the clinic, and how we test to see if an athlete is at high risk or low risk for return to sport. So one of the big things in regards to ACL injuries is that there are many stats and research articles on who's at risk and what sports are at risk. But what we do know for sure over years and years at looking at and dealing with ACL injuries is that females are at a 3-time more likelihood of having an ACL injury, especially in high school. And that's really where we're seeing the majority of ACL injuries. Usually from the ages of 15 to 20 years old are the big hits of people obtaining an ACL injury. Again, with females being 3 times more likely. Now, in regards to sports, which ones are the most at high risk? For females and males, female soccer is the one where the highest injury of ACL rates occur, and that's in regards to taking into account, I should say, that females are in that sport, and that also the type of sport that is being played. We just see a lot more lower extremity injuries, and ACL is at the top of that list. The next one is boys football. So between female soccer and boys football, we see a lot of ACL injuries come through the door. And the big things that we like to educate our patients or our athletes on is that we want to make sure we get them back to the lowest risk possible before they get back to a sport. And we take many things into account. One of them is time, and after having an ACL repair by a surgeon, we at least want our athletes to wait before returning to 100% participation for 9 months. And after that 9-month mark, we want to make sure that their physical abilities match up so that they don't go down the same road and re-injure that same ACL or even the other side, because we have seen that an athlete has one ACL injury, that not only is that same knee at a heightened risk of ACL injury again, but also the other knee itself can be at a high risk. Some of the things we look at specifically here is the motion analysis system we like to use, and it really takes into account sports movements. When we look at 5 specific sports movements, one of them being a jump landing, the next one is a jump landing with a counter jump, to see how they would do in activities such as rebounding and jumping up multiple times in a row. The other one is deceleration. The other one is lateral deceleration. And for the 5th one, we like to look at cutting, as those are big things we see in every sport from football to soccer. So in order to do that here at the clinic, we take a look at those movements with using our GoPro camera, which you can see is set up right over here. And that enables us to slow down those movements up to 240 frames per second so that we can really see what that knee is doing at these faster speeds. Our naked eye does not have the ability to really break down those movements that are so fast, and we've really seen that athletes are very good at compensating and hiding those improper techniques with those sports-related movements. So to go through those 5 movements, what I have my athletes do is I have them come up onto a step, and they'll step up here, and then from here I ask them to jump and just land in the softest way possible. So from here, I have them do something like that. And I want to take a look at how do they land and absorb all that energy. Now the next one I take a look at is very similar. You get back up on the step, and this one you jump and land, and then I ask them to jump up as quickly as possible and have that soft landing again. So it looks something like this. The other one, then, I will take that step away, and we'll look at deceleration. So what I'll have them do is I'll start behind the camera, run up, plant on that leg, and come back out as quickly as possible. This allows us to see how that athlete takes a lot of momentum and slows down on that leg that is injured. The other one we talked about earlier is that lateral deceleration, or kind of looks like lateral shuffling. I'll have the athlete start again over on this side, and if their leg is injured is the right side, I'll have them shuffle, plant on that leg, when they come into it, they plan and they drive back out from where they came from. Now, we want to take all those and look and see how they do with a movement such as cutting. So what I'll have them do is I'll have them work like they're going into the deceleration, plant, and then cut. So we're taking those movements from before and putting them all together into a movement that really looks like you're out on the field or out on the court trying to play your sport at full speed. From that, we take a look at many things, from the foot all the way up to the body and the trunk. And we want to see how that body reacts to those movements. The biggest thing we want to look at is that knee turning in or buckling in. And that motion right there, that buckling in and that turning, is one of the biggest mechanisms that can relate to an ACL injury. So that we can see, are you at a high risk or are you at a low risk from re-injuring that ACL? So when we do that, we'll take a look, we add up the points, we score it, and then we come up with an injury risk assessment or percentage that tells us, is the person or athlete at a low risk of re-injury if they were to go back to sport today, or are they at a heightened risk? From that, there's a couple things I like to do with our athletes, and we have set up this great ACL class or injury prevention program that can get a person back to sport as quick as possible, but also keeping in mind making a safe return to sport. And what that really includes is 3 phases. And the first phase comes down to doing a lot of strengthening and agility work. I have the athletes come in multiple times a week for 45 minutes, working on a specific set of skills or strength exercises that really get the legs and body strong so that it can handle those forces that are going to be seen out on the field at full speed. From there, we take another risk assessment, and if we don't like what we see, we offer that phase 2. And our phase 2 really gets more into specific movements that you just saw me run through. And we hit those really hard with our athletes that are in phase 2 so that they can prepare more specifically for those movements. Again, if we take the test at the end of that phase and we still want to see more improvement so that athletes at the best or the lowest risk of injury, we'll do a phase 3 that includes really specific skills and really specific exercises that are related to that person's sport. So if someone comes in for soccer, we're going to do soccer drills, and we're going to look at things at their test that they seem to really struggle with, and we'll do them in a sport-specific manner. After all 3 phases, then we hope to see that they're at the lowest risk of injury that they could be at, and that when they go back to their sport, that they're not going to have another injury in that leg or the other leg. After those phases, then we discuss with our athletes, the proper return to sport. Are we going to go 100% or 100% participation? Are we going to go back into a kind of a weaning process or introduction back to the sport? The big thing we see with these return to sport programs is that it can actually reduce the rate of re-injury up to 72% risk. And that's a huge, huge improvement from the old days of trying to get people back too quickly. Like the Adrian Petersons or the other athletes that we've seen in professional, where they go back at 6 months, and that's way ahead of time. We want to make sure our high school and college athletes are at their best and at their lowest risk of re-injury before we bring them back to that sport. Hope you enjoy it, and we'll see you for the next video.